I'm very pleased to be able to speak to you today at the launch of the NHS route map for sustainable health. I only wish that I could be with you in person. This government is committed to ensuring that our country lives within its means. That's true both financially and sustainably. And we are as committed to the health of the nation as we are to the health of the economy. Protecting health and well-being and ensuring high-quality healthcare. We are putting in place reforms that will help the NHS to become one of the most respected health systems in the world, and that includes being recognised for its sustainability. We're doing this by giving control to the front line, to those best placed to improve health outcomes, getting the best possible health outcomes for the financial and environmental investment that we make. Sustainability is essential for the long-term prosperity of any organisation. You can see great examples of this sort of behaviour in business. For example, Marks & Spencer's aims to be the world's most sustainable retailer, or the work the energy companies are doing to help people use less of the stuff they sell. They understand that what is good for the environment can also be in their long-term interests. This is even more true when it comes to healthcare, where so often what is good for the environment and sustainability is also good for our health. The public health changes we're putting into place will help people take more control over their own lives and their own health, helping people to make small, everyday changes, like walking or riding a bike, rather than taking a car. Encouraging people to be more active is good for their physical and mental health, and it's good for the environment, reducing things like carbon emissions and far fewer car journeys. It's also central to government's strategy of emphasising prevention as much as treatment. Let me give you just two examples of how a more sustainable NHS can deliver better healthcare for patients and reduce its impact on the environment. In Nottingham, hospitals have worked with local food producers, making every effort to source the best possible local food for patients, staff and visitors. Not only has this stimulated the local economy, it's increased the quality of food. Moreover, it's improved the experience of patients, helped to speed their recovery and perhaps even nudged them into eating a healthier diet when they return home. A huge benefit, but at no extra cost to the NHS. The second example is in Oxford, where people living with bipolar disorder can phone their doctor rather than having to travel every time to see them for an appointment. This more efficient, more person-centred care improves the individual's patient's experience and reduces car journeys. This is an excellent example of how technology is helping people take more control of their health and healthcare. By modernising the NHS, providers and commissioners of healthcare will all have great incentives to raise their game and to deliver far better outcomes for patients. The NHS can be so much more than it is now, and the work you see here today, I believe, proves that it will be. For the route map is not the result of a top-down mandate, it's a realisation by the NHS itself that it needs to change, and that by changing, the lives of patients and our society as a whole can be better. I'm particularly pleased to see what an excellent collaborative effort this work has been. Over 70 NHS and partner organisations have come together to make this happen. Today's event is an opportunity for the NHS to start delivering the ambitions of the route map, a more sustainable health service. I wish you every success. Thank you.